Hey there, everyone. Welcome back to another episode of the Growth Room podcast, where we dive into all the facets of healthcare with experts who are leading the industry. Please join me in welcoming Matt Rechin, the Chief Commercial Officer at ReadySet Surgical. Thank you so much, and we appreciate you for joining us, Matt. Can you please tell us about yourself and what you do at ReadySet Surgical?
Sure, Sal. Thanks for reaching out. Happy to spend time with you this afternoon. I'm the Chief Commercial Officer here at ReadySet, so responsible for all marketing, customer ops, things of that nature. Been with the organization for just over 4 years now. Prior to ReadySet, spent a long time with Steris Corporation, working in their infection prevention, capital, consumable, and surgical solutions business. And prior to that, spent a lot of time in the consumer packaged goods industries.
Very cool, very cool. So what's your workflow like? What's it like to be Matt for a day?
That's great. It's, we're a growth stage company. We've been around since 2015. I'm happy to report we've been growing by leaps and bounds every year. That's a tribute to our client base and to our sales and commercial team. They just do a great job at telling our story. But we work primarily with hospitals and surgery centers. And our job is to help them, particularly in the OR and SPD and supply chain areas, eliminate manual processes, reduce overall surgical costs, surgical device costs, and be able to perform at top of license. So we remove a lot of those manual tasks so that nurses, OR support people, SPD technicians, all those things can be performing at the very highest extent of their training or license. And in doing so, we help lead to healthier patient outcomes.
Wow, that's a pretty interesting problem to solve. As a critical support infrastructure to the healthcare system, how critical is technology in your day-to-day processes? What processes, tools, or tech do you rely on to perform optimally and to help end users perform optimally as well?
Yeah, great question. It's interesting that hospitals and surgical supply center or surgery centers, orthopedic, ambulatory surgery centers, things of that nature, think of all of the tremendous advances we made just in medical technology that have helped people recover more quickly, lose less blood, have better outcomes, all of those things. Interestingly, in spite of those great advances, oftentimes the business end of those on the hospital side is rather dated. So it's bogged down by manual processes, handwritten notes, handwritten pieces of paper with colored stickers on it, things like that. And it's not a criticism, it's just kind of this is how it's always been done. And everyone in our part of the world, from surgical scheduling all the way through to billing, everyone recognizes there's a better way. They just unfortunately don't have the time to really explore what the options are to change it. So that's kind of how ReadySet was formed. We wanted to eliminate all of that miscommunication, all of those manual workflows, all those types of things. So technology that we utilize, certainly machine learning and AI is a big part of what we're able to provide. We want to help improve visibility from the orthopedic surgeon all the way to the OR nurses, the SPD people. We want everyone to have better visibility into what's coming into their OR, what the cost of it is, and make sure that it's being billed accurately when it leaves. So the more and more we're able to rely on it, the more quickly we're able to do that, the more quickly a hospital is able to get reimbursed, the more quickly a patient gets billed, all of those things. So, we get to use a lot of other great technologies as well. OCR technology is big. So it's really a conglomeration of a bunch of different technologies that help us provide a pretty comprehensive and robust application.
Do you feel like technology do you feel like you're being overwhelmed by the usage of all these different types of technology, or do you feel like you need more of it because you feel like it could go in a piece of the puzzle over here and a piece of puzzle over there? How do you, is there a balance going on somewhere? How do you explain that? If you,
It's a great question. So if it's okay, I'll just years and years ago, probably to the last decade or so, hospitals did very well managing costs through point solutions. So very small, limited scope solutions that did one thing really, really well. And so then they would buy other point solutions to kind of bolt on to that. And although it did really, really well in that limited scope area, you ended up with a bunch of bolt-on technologies that couldn't really talk to one another and those types of things. So the technology has been available. It's really just been a matter of utilizing it appropriately. And I love your analogy there of the puzzle pieces, because that is what it is. When in order to complete a successful surgical case, you have a bunch of puzzle pieces, and very often the hospital doesn't have the technology or an application available that helps you pull all those puzzle pieces together to have a seamless workflow, seamless communication, and seamless billing process. I'm fortunate that at ReadySet, we think we have solved that conundrum, but it doesn't mean that it's been, that anyone has a silver bullet for it. We think we're close, but that is really what needs to be done now. That hospitals, amongst any other business category, is really dealing with things like that.
yeah, appreciate your answer on that. What about the team you lead? What kind of challenges are they facing? And what are their type of technical solutions do you think that would improve their performance, or what kind of action needs to happen there?
Yeah, sure. I mean, we're no different than any other growth stage business. We want to be able to do things more quickly and obviously be doing them better tomorrow than we do them today. On the client engagement point of view, we're blessed. We've got an amazing group of clients that really believe in what we do and they support what we do. Most of the time, when we begin speaking with a prospective client, we hear horror stories of the last time I said yes to an IT solution, it couldn't integrate with our solution, or all of these things I was told this thing was going to be able to do, it was only able to do half of it. So there is a large kind of this groundswell of a story out there that buyer beware on purchasing an IT solution or things of that nature. I'm happy to say that we've got a pretty unique approach that we use when we begin to engage with a client, where we kind of work along with them from the very first day to understand what are your current workflows, what kind of processes do you use, things like that, so that the application that they end up deploying from ReadySet is very light in infrastructure and very agile, in that if you've got a very small community hospital that does less than 300 cases a year, or you've got a very, very large academic center that does over 25,000 cases a year, we have a solution that ends up feeling like it was built just for you. So those things really help us get past kind of the status quo, or the feeling like, yeah, we know it's broken. We know the process is broken, but it is what we know, and we know that we're going to be able to do surgery and those types of things. So fortunately, we've got a outstanding sales team. They're able to go in there and build partnerships with clients around let's figure out what you need most, and then we'll make sure that we deploy that.
Very interesting, very insightful. Thank you for that. So let's jump into AI.
Sure.
It is such a big topic right now. I would say 9 times out of 10, people are telling me, yeah, they're looking at it very closely and they're starting to get their feet wet. What are your general thoughts about AI in healthcare right now? Where is it going to be deployed, or what are your plans of deploying it, whether internally or as a product? How are you going to utilize this?
Sure. Well, we're no different than any other technology company out there. We're very excited, obviously, about AI, the power of AI, and the benefits that it should be able to provide. Certainly, from a healthcare perspective, it's almost limitless where AI will make an impact. Right off the top of my head, I mean, think about just from a diagnostic tool to being able to put together treatment plans, optimal treatment plans based on the patient's biometrics or things of that nature. There's, um, you know, something that really allows every surgeon to pull very, very best practices, best optimal solutions, etc., to have them at the push of a button is going to change the world. We tend to believe. And that's obviously very exciting, especially for things like chronic diseases. How to manage obesity is just one that comes to mind. But cancer treatments, just an example, are things that have been where we've made tremendous advancements, but we still haven't kind of put it to rest, so to speak. So I just think from being able to provide greater diagnostic ability, prognostic ability, treatment plans, it's going to be it's going to be an amazing next decade. I can't wait to see what happens. On the business end of things, it kind of goes back to what I was saying before, and it's funny. If you are a technology provider and you have an application that you're selling into the healthcare space, everybody and their brother has some type of analytic dashboard. Oh, we've got the very best analytics, and I think it's great. Everyone should have analytics. What has happened though is everyone now has analytics to tell you what happened historically. No one has figured out, like, maybe it would be really good if we started putting some predictive analysis into your workflows based on what's happened to tell you what is going to happen, how you can better plan workflows around it, how you can better build out your headcount designs, all those types of things, how to reduce overtime, all of those things that help reduce the costs. I was just reading a report earlier this morning, over $700 billion a year in healthcare leakage, revenue leakage, based on them not, hospitals and healthcare organizations, providers not being able to collect from treatments that they've provided, and bad debt and how that's growing and all those things. So if you're able to harness the power of AI, or you're able to speed up your ability to bill a patient, you're able to through a ReadySet application, you're able to get your billing codes accurate. You're able to crank out a PO same day, hands-free, out the door PO, 100% accurate. You're able to get your reimbursement more quickly, bill the patient more quickly, which leads to a better chance of the patient be able to pay their responsibility. All of those things are going to be impacted. We're fortunate here in ReadySet where we think we've already built a pretty strong solution that utilizes things like machine learning and AI, so that it eliminates things as simple as a nurse, having to sit on the phone for the entirety of his or her shift, calling reps to say, "Are you dropping off trays for our cases tomorrow or not?" Like, just and then be able to take that behavior and post it out over a predictive scenario as to when is the optimum time to receive these trays and how long does it take us to get a tray through the sterile processing department. So I think you could tell I get pretty excited about the topic, but safe to say there is no limit to the impact that machine learning and AI is going to have in our part of the world in healthcare.
Very wonderful answer. Do you, with all this AI that's happening, everybody getting their feet wet or their hands dirty with this new just boon of technology right now, do you feel like it's being underutilized, and in the sense that there's a little bit of data literacy that's involved with knowing how, like, for example, if you were to adopt a co-pilot solution, like a physician were to adopt a co-pilot solution where the co-pilot will help the physician in a diagnostics scenario, um, does the physician at that point need to have some level of data literacy to control that co-pilot? And would this span out to everybody in the healthcare org having a co-pilot? Because everybody could utilize it, right?
Yeah, I mean, just like anything else, there are certainly risks of any new technology. What we have seen and what our experience with all our clients has kind of shown us is that hospitals are um, uniquely interested in how to best pull the power of AI to make an impact right away. You know, they live in a case by case, day by day kind of world. So, and that will never stop. It's not like you can say, "Hey, let's close the store tonight, and we'll reconfigure all of our shelves so that it works with this new AI-driven system." Hospitals don't get that luxury. So, they have a lot of really, really smart people in the industry that are kind of saying, let's build some kind of universal standards around what we think AI means, how we think it'll translate into patient care, and then how it can be utilized on the business end. So, we certainly haven't seen the end of the growth of AI. We've got a lot that we can still learn, but as you said, in many of these things, it starts with the strength and quality of the existing data that you have. And believe it or not, there are still hospitals that may struggle with things of that nature because it is a very manual process, or there are manual processes that support getting that data and getting it transported to another system that you have. So, what we like to say at ReadySet is you're only as good as the power or the ability, your ability to be able to integrate with any number of other solutions in the organization. So, in this day and age, in the world of open APIs, if you don't have a solution that is able to integrate with a standard or non-standard system, or worse, you think you're going to charge other systems because they want to integrate with your system, you're living in the dark ages. That's just not how it works anymore, or there wouldn't be things like open APIs. So how all those things impact AI, I am probably not the smart. I'm not the smart enough guy to be able to answer that question. But I do think it's safe to say we've just scratched the surface of how we can pull this power of historical and then predictive data, and what those impacts will be relative to an AI-driven solution.
Thank you for that. Um, what are the top 3 technological improvements that you believe would have the most impact for you at ReadySet Surgical in 2024?
Yeah, so sure. I guess to start with, it's being able to root out. We kind of look at it, people, process, and technology, right? So, amongst those three things, let's just say as an example, you think you have a great application that will help automate a process that today is manual. But if the people in that process don't understand what it is that that change is going to be, and all you're really doing is taking a broken process and adding automation to it, you haven't really fixed anything. You've just automated a broken process. So we look at things from kind of that comprehensive, more holistic way people process and technology and say, how does our automation and our technology and our application pull those three things together in order to help a hospital perform better? So things such as making sure that we are kind of removing people from the policing vendor business into the creating healthier patient outcome business. So I'll give you an example. There's a young child, let's say a child that's less than a year old, and they're having surgery on their skull to repair their skull. And you've seen infants before that wear those little helmets on them, and so that's a surgical implant that goes in to help repair it. So 7 a.m. in the morning, the patient is on the table. The doctor's waiting on the rep. Someone calls the rep and says, "Where are you?" "We're in the room." Rep says, "What are you talking about? I don't have a case today. No one told me that there was a case today." "Oh my gosh." So then everyone's running around trying to find out what they need. And what happens is that case, just as an example, it ends up going from being a very simple case to a more complex case. The costs of that goes from like a same day discharge to a patient having to be in overnight, having to be in ICU for an evening, more blood loss, more exposure, infection, all of these things. So the cost of that case is 2 to 3 times what it could have been had the patient or had the rep known about the case on time. So when you think about technology for us, we want to be able to push communications to the rep the moment they get entered into an EHR, and we want to be able to pull data from the submitted charge sheet at the end of the case and match it with the hospital's ERP so that they can crank a 100% accurate PO in less than 24 hours of the case being closed. Anything in there that touches those things has importance to us. There are any number of avenues we can go outside of that. Think about cath labs and neurospine, all those types of cancer treatments, things like that, that require the hospital to go and seek other things for the OR. ReadySet can have a positive impact on those. So as great as our technology is, I'm confident that a year from now, we will look from a technology point of view much more significant and have a much larger scope than what we have today. And a year after that, we'll look even more different than we look a year from now. So it's an exciting time. It's exciting for us in the world of healthcare, exciting for us here in the world of ReadySet.
Wow, what an adventure. My concluding thoughts are that AI has a big role to play in healthcare this year. Implementing AI really well will provide the most impact out of anything else. It was such
No doubt about it.
It was such a pleasure having you on the show. Matt, I'm looking forward to having you on for future episodes.
Great. Thanks, Sal. Have a great week.
You too.